Today we're going to be waving our magic filler wand and seeing what we can achieve in under 30 minutes. Hello TLCers, we've got a real treat for you today. I'm going to be showing you how I do some of my injections in practice. Patients sometimes ask me, how do you know exactly where to put your injections? How do you know that it's going to make me look better, not worse afterwards? Well, I have a very, very simple way of knowing where to go, and it's all done with maths. These are my beauty calipers. I'm sure you must have seen something like this on YouTube or on Instagram before, where people are measuring like the width of the nose or of the chin, or to look at the height of the eyebrow. And I use these in my clinic to see exactly where I need to put the injections to make someone look more beautiful. And the way that's judged is according to Leonardo da Vinci's principles of phi and beauty, because they're phi calipers. And although they look different to each other, actually they measure exactly the same thing. So you can see if I turn them upside down that they're actually quite similar. At some point in the future, I will be doing a complete video on these, but for now, safe to say, they help me place the injections in the right place to make you look more beautiful. When we first get a patient into the clinic, we do a 3D model of the face, and we also do an assessment using the phi calipers to see exactly where the product needs to be placed. Then we have a look at the person in movement, so asking them to smile, to laugh, to pout as well, so that we can have a proper look at the facial structure. Okay, so let's have a look at her now in animation. Let's just get her to raise her eyebrows up and down. And you can see here that the tail of her brow is quite curved. Can you see how the tail of the brow is pretty low? And on a female, it's much better if the tail of the brow is slightly angled upwards. So that's something that we can definitely address during the treatment. You can see also that she's lost a little bit of volume in the mid portion of her face, just in front of the ear. And something that's really jumping out at me here is how short her chin is. Can you see how short that lower facial third is in proportion to the rest of her face? Now, Jessica has actually had her lips augmented before, and she wanted to have them a little bit bigger. So I think that that's something that we can definitely do for her. But in order to do that, we need to really put that at the end of the treatment plan, because in order to make the lips look good, she needs to have the rest of the face slightly elongated first. If you're going to make the lips look bigger without doing the rest of the face, it's going to look really, really weird, because they're going to be these huge lips, and then the bottom part of the face will be all kind of squashed in on itself, and it won't look natural. But if we augment the rest of the face first, it will look super natural. The first thing that we're going to do is an eyebrow lift. So we're going to use botulinum toxin to do this. Before I start to show you how the procedure's done, I just want to say one thing, which is that I am providing a service for my patients, not a product. So although you can see that she has got an eyebrow lift using this particular toxin, it doesn't mean that the results would be the same for you. So it's really important, before you decide to have anything done, that you have a proper consultation first with a prescriber who will be able to tell you whether or not the treatment's right for you. You've probably seen other people on Facebook or Instagram or YouTube having the same thing done, but it doesn't mean that you're going to have the same results just because you've asked for that particular product, because every face is very, very different. First, we're going to show doing the botulinum toxin injections. So this patient, the eyebrow goes down laterally at each side, and we need to try and raise that. The second thing is, when she's smiling, the eyes screw up a little bit. I always find on younger people, you can get complete reduction of movement in the forehead and the glabella and the crow's feet, and it doesn't look weird. If I did the same technique on somebody who was a little bit older, maybe in their 40s or 50s, it would look really super unnatural. So this technique is only suitable for younger people. What you can't see on this video is that I'm injecting a bit closer to the actual eye itself, and I'm not showing that because that's my special technique and you can't see it. Now we're moving to my favorite portion, which is the filler. Really love filler. We're going to start off by doing the cheek. So you can see here, we're injecting directly on top of the cheekbone there. And what this is doing, we're not doing this to make the face look like she has bigger cheekbones. The idea of it is to use that filler like a sticking plaster. So you're injecting it straight down, like on a sandwich technique. So you're going straight down so that you're leaving these struts of filler all the way along the arch of the cheekbone. So in this way, it means that you can hold the rest of the skin up, which is pretty cool. Now, I know when you look at her from the front now, she's going to look like well, on the screen, it's the left side of her face will look a little bit wider than the right side. But when I do the rest of the face, you'll see that this will blend in really nicely. Some people do like to have that width. Personally, I don't particularly like it, but you know, each to their own. The next injection that we're doing is adding some dermal filler to the chin, again using the needle. So you can see that we're injecting here directly into the midline of the chin. And the purpose of doing this is to elongate her lower facial third, which we previously measured using the calipers. Interestingly, this takes her face into slightly more of an oval shape. So the most beautiful face across all cultures is considered to be the oval, and the second to be the heart shape. So we're going to try and recreate that a little bit when we're using our fillers. Now this is my absolute favorite injection. It looks good on literally everybody. Some people call it the next top model look, which means that it emphasizes and highlights your cheekbones upwards and backwards and gives you that like sexy hollow underneath your cheek slightly. So what we're doing here is using a cannula. Remember, the cannula is the blunt-ended needle, and so it passes safely through the tissues. And here I'm putting the filler directly into the hairline, so you can't actually see it. It's a really crafty way of adding volume to the face and giving lift, but without actually altering the facial structure at all. Now this looks a little bit weird. We're doing the chin again using a cannula, but this time from the tip of the chin. And we're adding the product all the way up to the lower lip and really volumizing and pointing off that chin into a more feminine sort of shape. You can see that there's still a degree of asymmetry in the lower lip, like it just comes down at one side a little bit more than the other, but we're going to be seeing her again in another video, which you're going to have to watch out for, and over time I'm going to look to correct this. You can't build Rome in a day. I'm sure that's what they said, right? Next up, we're doing the angle of the jaw. So as you get older, you lose the contour between the angle of the jaw and the neck, and it all just kind of blends in together to be one straight line. And it looks much better if you add a little bit of filler into the angle of the jaw just to make it pop out a little bit more and give you that contour back. Now we're going back to the chin for the third time this session to add from a slightly different angle. And you can see again, I'm using the cannula pointed downwards to the base of the chin to really give her a very feminine shape. Because remember, I said the lower facial third was much shorter than the other thirds. Last but not least by any means, it's most people's favorite injection. It's the lip. So when this patient first came in, she'd already had her lips injected before. So for me, they already had like a slight line around the vermilion border. I wouldn't normally do this for one of my patients. Rather than get rid of the filler that was already in there, we decided just to give her a very soft looking augmentation using a cannula. So you can see here, you can reach the upper and lower lips just from the one entry point, and a lot of people comment how this is really a lot less painful than having the injections performed with a needle. But as you can imagine, the results that you get with a needle or with a cannula are all very, very different. So it really depends on what results you want to get and what you've come in with as to exactly which method we would choose to use. So to summarize for you, we had 30 minutes, and in that 30 minutes, we managed to do botulinum toxin to the 3 areas plus my little special injections around the eye. We also did some filler to the cheeks, the chin, the jawline, and the lips. And if you look at her now, I think you would probably agree she could go out for dinner or, you know, wherever she wanted to go this evening and not look weird. Except for the fact that before she left, we did a chemical peel, which makes her look very, very orange, unfortunately. The reason that we did that was just because she had some skin surface texture irregularities. So I thought, why not? You know, who doesn't want to have better skin? Okay, so that's it for this week. I hope you enjoyed the video on how a procedure can go. Join me next week for some more top quality content. Please like, comment and subscribe. And if there's anything that you would like to see in particular, please just comment below.